Hi everyone, I'm THERESA Martin, clinical audiologist at Bangalore Hearing and Implant Institute. So today's webinar topic is cochlear implants. So in this webinar, we will cover what is a cochlear implant, how does a CI work, and what are the components of a cochlear implant, and who will benefit from using a CI. So what is a cochlear implant? So it is a surgically implanted device used for hearing rehabilitation of individuals who have advanced sensorineural hearing loss and poor speech discrimination and who get no benefit from using a hearing aid. So it's ideal for both adults as well as children for both pre and postlingual hearing loss. So the first ever CI was the House 3M cochlear implant, which had a single electrode array. Later, the first multi-channel implant was introduced by Graham Clark in Australia during 1970s. And this was a cochlear nucleus freedom implant, which was FDA approved in the 1985. So what are the components of a CI? So a CI system will have external as well as internal components. So the external components will include the microphone, the battery, the speech processor, and the headpiece. So here you can see the external component of a CI. And the internal component will have a receiver stimulator and an electrode array. So the microphone, which will be housed in the speech processor itself, and it will convert the acoustic signal into electrical variation. So it captures the acoustic signal from the environment and it converts into electrical signals. So usually a CI will have dual microphone on its processor. And the speech processor, you can see here, this part of the CI is called the speech processor. So this receives the signal from the microphone and will transform it into an electrical code, which will be processed according to the processing strategy used. And the headpiece, here from the speech processor, the information is sent down a cable to the headpiece. So this headpiece houses a transmitting coil as well as an external magnet. So this signal from the processor is transmitted via a radio frequency using a transcutaneous connection to the internal receiver stimulator. So this is the headpiece of the CI. This will have a magnet as well, and using this magnet, it is held in place. Next is the battery. So below the processor, this part of the CI is called the battery. So this can be a rechargeable battery as well as we can use disposable batteries. And coming to the internal part of the CI, so you can see the receiver stimulator here and the electrode array. So this is a close-up picture of the electrode array. So the receiver stimulator, it is surgically placed into the small bed which is drilled in the skull just behind the pinna. So the receiver stimulator will have an internal magnet and it actually takes a signal from the external coil and it converts it into rapid electrical impulses which is distributed to the electrode array. So the electrode array stimulates residual auditory nerve fibers along the modulus and in the 8th cranial nerve. So this is placed in the scala tympani. So the electrode array is generally we prefer an electrode which will be close to the spiral ganglion cells for best localized stimulation of the auditory nerve. So in this video, we can see how does a CI system works. You can see the external component as well as the internal component. So we can see how does it work together to provide a sensation of hearing for the hearing impaired individuals who's using the cochlear implant. So you can see the head level processor worn outside the skin. So from this processor, the microphone captures the sound and it converts it into acoustic signal. So you can see the behind the ear processor as well. So this sound which is processed using the processor, it is further transmitted to the internal receiver stimulator through radio frequency. And from the receiver stimulator, it travels down to the electrode array as electrical impulses. And these electrical impulses further stimulates the auditory nerve. and then it works normally like the normal hearing. So that is how a cochlear implant system works to provide hearing sensation for the user. So now we can see the candidacy of the cochlear implant. So when we consider candidacy, we mention the medical history, the medical candidacy, the radiological candidacy, as well as the audiological candidacy. So coming to the medical candidacy, a thorough audiologic medical history has to be taken to determine the etiology of the hearing loss or any underlying comorbidities. So prelingual as well as postlingual deafness can be candidates of cochlear implants. So when it comes to prelingual, it can be a congenital sensory neural hearing loss, and postlingual can be any sudden SNHL or hearing loss due to any viral infections. And we also should take into consideration the duration of deafness, because it is directly proportional to the auditory deprivation which the person have gone through, which can affect the outcomes of a cochlear implant. And the presence of comorbid conditions such as cognitive disorders or developmental delays or structural anomalies also should be taken into consideration. So coming to the audiological candidacy, the audiological candidacy is very important while considering a cochlear implant. So this applies differently to children as well as adults. So in children from 2 to 17 years, a bilateral severe to profound sensory neural hearing loss can be considered as good candidacy for a cochlear implant, and the child should be benefiting very little or not at all benefiting from using binaural hearing aids. And coming to speech discrimination, speech discrimination score of less than or equal to 30% in multisyllabic lexical neighborhood test can be considered. And when it comes to younger children, 9 to 24 months, a bilateral profound sensory neural hearing loss with little or no benefit from using binaural hearing aids can be considered as a good candidate for cochlear implants. And next we'll see about adults. So when it comes to adults, the candidacy is moderate to profound sensory neural hearing loss in both ears with limited benefit from amplification. So when it comes to speech discrimination scores, a preoperative score of less than or equal to 50% sentence recognition in the poorer ear, that is the ear to be implanted, and less than or 60% in the opposite ear or binaurally should be considered. And we have an expanded criteria because depending on the individual, we can consider adults or children with greater degrees of residual hearing. That is, we can consider adults who have residual hearing in low frequency but who need electrical amplification, the high frequency. And also there are some non-traditional indications which can be a single-sided deafness or a retrocochlear hearing loss, which is a hearing loss due to any retrocochlear pathology such as vestibular schwannoma, or an asymmetrical sensory neural hearing loss in adults and children when one ear is very poor compared to the other ear. Also for children who are less than 12 months of age, depending on the candidacy, we can consider a cochlear implant. And one more thing which we should keep in mind is a radiological candidacy. So a thorough radiological evaluation must be done prior to the CI surgery to rule out any anomalies of the temporal bone or cochlear duct, internal auditory meatus, and cochlear nerve. So an MRI or a high resolution CT is recommended, which will obtain a precise anatomy. And it is also important to rule out a complete labyrinthine aplasia or a cochlear aplasia, cochlear nerve aplasia, or any cochlear ossification. Also, a history of meningitis, temporal bone fracture, autosclerosis, etc., can warrant a closer review of the temporal bone imaging. So, in case of any such disorders, it can complicate the surgical procedure or the implantation. So, in such cases, further imaging will be required. One more thing which we should consider along with the candidacy is a preoperative counseling. So when we counsel a patient before the surgery regarding the cochlear implant, it should provide a realistic expectation, and the clinician should explain thoroughly about the risk, benefit, goals, and expectations of the CI surgery. Also, the user must be counseled well about the post-implant rehabilitation and the mapping procedure which is required to provide adequate benefit from a cochlear implant. So now let's see about bilateral, bimodal, and hybrid cochlear implant. So these are the methods which is recommended to give amplification or aid to both ears. So a bilateral CI means um, when a cochlear implant is given to each ear. So bilateral means sound is being presented to both ears at once. So bilateral implantation is considered for who have bilateral profound hearing loss. So bilateral CI can be done in two ways. It can be simultaneous or sequential. So simultaneous involves implantation of CI into each ear during the same surgery. But in the case of sequential, it involves two different surgeries which can be weeks, months, or years apart. So this is how a bilateral CI will look. So you can see CI in both ears. So this will provide electrical amplification, electrical hearing in both ears. Next is a bimodal. So this also can provide binaural hearing, but in this case, one ear will have an electrical stimulation through a cochlear implant, and another ear will have an acoustic stimulation through a hearing aid. So here you can see one side you can see a cochlear implant, and one side you can see a hearing aid which will provide acoustic amplification. So both of these models, that is a bilateral CI and the bimodal CI, will provide binaural hearing. So binaural hearing is the integration of bilateral sound inputs which travels up the auditory pathway. So binaural hearing has certain benefits in terms of localization ability and better speech recognition in noise, and it also prevents auditory deprivation in the other ear. So binaural hearing can be considered through a bilateral CI or bimodal hearing. Next is a hybrid CI. So what is a hybrid cochlear implant? So this is how it will look. So in this picture, you can see a cochlear implant sound processor, but as well as you can see a receiver at the tip, like that in a hearing aid. So a hybrid CI works by virtue of electroacoustic stimulation. So here what happens is that the high frequencies will be stimulated using the electrical stimulation through the cochlear implant, and the low frequency amplification will be provided from the hearing aid. So this is actually considered for adults who have residual low frequency hearing but who also have severe to profound hearing loss in the high frequency region and who does not benefit from bilateral hearing aids. So in this case, we can consider hybrid CI, which will provide acoustic stimulation as well as electrical stimulation. So now let's see what is the importance of early intervention. Why do we say we should provide early intervention using a cochlear implantation in children who have severe to profound hearing loss? So providing intervention via a cochlear implantation in a child who is born with severe to profound deafness will increase the exposure of the child to auditory stimuli. So this exposure, this early exposure to auditory stimulation will enable the child to better understand language and to develop language. So this better speech and language development can lead to overall cognitive and social development. Like for example, they will be able to make friends, they will be able to communicate to other children in school as well as outside the school, and this will in turn enable the child with hearing impairment to attend mainstream school like any other typically developing children.